Good evening, and thank you for joining us for the second session of a two-part series, The Roller Coaster of Caregiving, Navigating the Ups and Downs During COVID-19, a mental health roundtable discussion for caregivers. I am Angela Bailey, the Executive Director at the Kensington Reston, an assisted living and memory care community in Reston, Virginia. At Kensington Senior Living, our promise is to love and care for your family as we do our own. We are committed to improving the quality of life for seniors as well as the caregivers who love them. So we seek out support from specialty experts to deliver topical information and resources that help boost caregiver morale, preserve energy, and keep stressors in check, especially now during our COVID-19 reality. Just a couple of housekeeping items before we start. This presentation is in webinar format, which means your camera and microphones are automatically off. If you have any questions during the presentation, please feel free to enter them into the Q&A box. This evening's moderator will take time at the end of the presentation to answer your questions. At this time, I am excited to introduce our presenters. Tammy, would you please introduce yourself and tell us a little bit about you?
Hello, everyone. Thank you for attending today's webinar. My name is Tammy Anastasia. I am a dementia consultant and educator. I'm also the author of Essential Strategies for the Dementia Caregiver Learning to Pace Yourself. And I have a private practice where I provide dementia guidance, emotional support, care strategies for families, caregivers, as well as professional caregivers, taking care of people who have dementia. I also facilitate several caregiver support groups throughout the San Francisco Bay Area. And I also am a professional speaker on a lot of different dementia-related topics. I have a master's degree in counseling and a certificate in gerontology, as well as a certificate in end of life. And I am a certified senior advisor, as well as a dementia care specialist.
Perfect. Thank you so much, Tammy. Next, we have Dr. Mand.
Good afternoon, everybody. Thank you for coming. This is Dr. Rochelle Mand. I am a psychologist in private practice. I have been helping caregivers. That's my specialty for quite a long time. And I've come to this through personal experience and going through what life is like as a caregiver. So I'm excited to share some ideas and experiences with you. I have my license to practice is a marriage and family therapy license. I have been in practice for over 40 years, doing a variety of clinical things. And at the moment, I am primarily online, I guess, due to COVID and just a change in a lot of our lives and professional lives as well. So I do my consultations primarily online, and I'm excited for us to have a conversation today.
Thank you so much, Dr. Mand. And next we have Dr. Mandati.
Hey everyone, my name is Dr. Vikas Mandati. I'm an adult and geriatric psychiatrist. I'm experienced in treating mental health problems for older adults. Like the title of the presentation, caregiving can be an emotional roller coaster. Caregivers take on a lot of responsibility, they have to make difficult choices, and it can be very stressful. Becoming more knowledgeable about the situation and how to handle problems usually improves the life of the caregiver and their loved one. So today, I hope to share some insights with you that may be helpful for you to understand what's happening with the loved one, why it's happening, and what you can do about it.
Perfect. Thank you so much, Dr. Mandati. And now we have our moderator for this evening, Dr. Edisam.
Good evening. Good evening, everybody. I'm Dr. Edisam. I'm currently the acute inpatient rehab medical director at Reston Hospital Center, and I'll be your moderator for tonight. Our format will be similar to the last presentation that we had. We'll be having a roundtable discussion. We have a couple pre-selected questions that we'll be going through. And at the end, we will leave some time for some live Q&A. So I encourage anybody out there that's watching who has any questions, feel free to type it in the Q&A box, even now and during the presentation, and we will get back to it towards the end of the presentation. All right, and if there's no other announcements to make, I'm just going to jump right into it, okay? So the first question we have for tonight is we want to address some of the whys. Why do people with dementia refuse my help? Why do they blame me for everything? And why do they ruminate about things? Miss Tammy, we'll start with you.
Yeah, so these are all typical behaviors, normal behaviors for people with dementia. Keep in mind, people with dementia have a progressive, degenerative brain disease. So what does that mean? That means that the brain cells are going to start to deteriorate. So they're going to start saying and doing things that may not make sense, that may be incorrect. And it's very normal for them to do those things. And how to interact with it is you want to avoid arguing, you want to avoid correcting them, rather than you want to validate and hear what they're telling you and then provide a reassuring and comforting response. So usually when somebody with dementia is refusing your help, a couple things could be going on. They don't understand what you're asking of them. They could be fearful, they could be concerned, and they may not like the approach. And as the brain progressively, those brain cells deteriorate, they become increasingly confused. So we have to adapt and we have to change on how we're going to relate to them, because their brain is no longer going to process information in a rational way. So we have to adapt to them. So if they're refusing our help, that's usually a sign that we're doing something off, that we have to figure out how to meet them where they are, how to explain it in a way that they understand. And often what that entails is we have to break down the steps. We have to do one step at a time. We need to speak slower and give them time to process information. But you do need to know that they are not refusing help. They're not blaming things on purpose. They're not doing it to annoy you. They're not doing it to upset you. This is part of what happens when you have dementia.
Well said, Miss Tammy. Dr. Mandaddy, we'll go on with you.
Everything that Tammy said was correct. People with dementia may not be conscious that they repeated something or ruminating on something for a while. With most dementias, there's a progressive loss of short-term memory. They're simply not conscious that they asked you something or that they repeated it. They might not even be fully cognizant of their disabilities, and they likely want to continue to feel independent. This can lead to a reluctance to accept help. When they're not able to accomplish something independently, it can be frustrating to them. And that memory loss, that confusion compounded with the loss of independence can be quite stressful for them. They may blame others for problems because they simply don't have the clarity about the situation.
Well said. And lastly, Dr. Mand.
Yes. One of the things that all caregivers have to keep in mind is that when you start this job, you really have to educate yourself. You have to find out what is this disease going to be like a year from now, 2 years from now, 5 years from now, and get yourself ready. The other thing is that you have to know that your normal relationship with that person will always change. So you will always have to get used to a new normal, because they will deteriorate and the normal between the two of you changes. So you have to be always ready for that. The other thing to keep in mind is that we have to be very, very careful not to speak down to them, not to be condescending with them, to have the uttermost respect, even though they may not come across as very logical or very connected and oriented, but the caregivers have to exercise utmost respect for our older population. And the fact that you know that it's not your fault, you're not like Tammy said, maybe you need to change your style, but you're doing the best that you can. It is a disability. It is an issue that you are faced with and you're dealing with. So you have to just learn all that you can about it, so you're in a better position to just handle what's happening.
And
Very well said.
I'd like to capitalize a little bit more on what Dr. Mann said about that. And that's it, right? We have this relationship with our loved one pre-dementia, then they do get dementia and dynamics change. And so I often say we've got to know what our own triggers are. We need to know what those triggers are, because they may say and do things that push our buttons, but it's not for the same reasons they might have done it pre-dementia. So I want to just elaborate that, you know, what Dr. Mandati and Dr. Mann have said is that we have to, the more educated we become, the better equipped we're going to be to deal with the changes that happen. And we still have to treat them with dignity and be very respectful. And I always say, when in doubt, listen. The person with dementia will say or express a need, and all behaviors are a form of a need, expression of a need, whether it's verbal or not verbal. And I always say, when in doubt, listen to what they're telling us, because that may cue us in on what we have to do differently in order to know how to manage their behaviors.
Excellent point. Yeah, I think everybody made really good points, gave out some very strong advice. I mean, I think, you know, similar to any major life-changing event that you take head on, preparation is always going to be key. I mean, the more level-headed you can be about a situation, the more that you can prepare yourself for a certain situation, the better off you'll be. And I think the information you guys gave is timeless. I think if someone has heard it once, twice, you know, 3, 4, 5 times, I think you can't hear it enough, right? It's good to get this information for the first time. It's good to reinforce it. And it's good to remind yourself, you know, I mean, it's a big deal. It takes a lot of work, but you know, the more support you have, the better off you'll be, I think. So for the next question we have, it's what can I expect as the disease progresses? And we'll start off with you, Dr. Mann.
Well, it kind of a follow-up to what I said. What can I expect is that's exactly what you should be looking at, studying, becoming part of the medical team, because you are part of the care of this person. So if at all possible, talk to the geriatric doctor, talk to the neurologist, talk to the whoever is taking care of this problem, and educate yourself, ask questions, and try to get as much literature, talk to other people, get into support groups so that you can learn from others what they're doing, and you also have a lot to teach probably to them as well. It's very, very good to have a support group that you can go to on a regular basis so you can discuss these ideas and learn. But education is the name of the game. It's what to expect is what you have to learn, what it is that you have to expect. You just have to learn it, and also listen to the person, because they are telling you as they are talking. You can tell what is happening in terms of the cognitive development, or speech difficulties or other kinds of difficulties. You can see what is happening, and then go out there, get some more education.
Excellent. Ms. Tammy?
Yeah, so the disease, as I mentioned earlier, is progressive. So it's going to be over a time frame where we're going to see them deteriorate. And dementia affects every single functionality. It affects their thinking, their reasoning. It affects their ability to take care of themselves physically. It affects their ability to process information, to problem solve. And how long it takes for this disease to progress varies from person to person. So, but what we do know, it is often the Alzheimer's Association, I think, coined it, you know, it's a long goodbye. And sort of what happens over time is that they change on so many levels. And what the caregiver needs to know is you're going to end up being the one making all of their decisions for them. you're going to make all the decisions. And in the end, it's going to come down to, at some point, they're going to need 24-hour care. And one of the most difficult decisions you have to make is, do we bring in home care for 24 hours or, 24 hours, or do you place them in a care community? Because dementia demands more help and support than one person can do as this disease progresses. So to capitalize on what Dr. Mann said, yes, get all the support that you can, but more importantly too, is be able to gauge yourself as you walk down this journey, because it can deplete your energy, and the stress and the demands can weigh on you so much. But as your loved one deteriorates, you want to also modify the activities, and they still need to have a sense of purpose and a sense of value. So as your loved one deteriorates, we still want to engage them in activities and do things that will still stimulate their brain and physically stimulate them, but more importantly, still gives them a sense of purpose all along this journey. And we have to modify how we do those things. But this journey can be a very long journey, and up and down, and many, many challenges. So the dementia also demands that you take care of yourself as well as taking care of your loved one.
Could not agree more. Dr. Mandati?
So the question was, what can I expect as the disease progresses? And that disease is dementia. I thought I could talk about some of the signs and symptoms that you would see. There are multiple kinds of dementia affecting older adults. Late onset Alzheimer's is the most common, presents after 65. It's different for everybody, so it might progress faster in somebody than somebody else. It's completely dependent on the individual. And what's important to know is initially that you might find that your loved one has difficulty finding the right words, might forget recent events. They might be unable to do complex tasks like taxes, finances. They might lose things. You'll notice more confusion, short-term memory loss, disorientation. Then what happens is personality and behavior tends to change. They might become more apathetic, more withdrawn. They might be showing less interest in their hobbies and activities. They may become less agreeable to you. At this time, you want to focus on their physical health, because let's say they forget to shop for groceries, take medications, cook, they might not be getting the nourishment that they need. And then later stages, unfortunately, this is where there's a considerable loss of function. Your loved one might be unable to walk, sit down, might lose the ability to communicate, might lose the ability to maintain hygiene by bathing, brushing, toileting. The body itself can also become vulnerable to infections. Whether someone should go into memory care or not, or have a higher level of care, really depends on their needs at the moment. Everyone progresses differently, so that's really individual to that person.
Well said. And I know anyone that is in this position at the moment can definitely attest to the fact that as the disease progresses, the challenges will manifest in different ways, and they will kind of compound on each other too. So I know the disease progression is a tough thing to think about, but like we alluded to before, preparation is key. Making sure you have support and all the help and information you can get will all help too. Our next question is it safe to bring
You're frozen.
in caregivers into my home or move my loved one into? Can everybody hear me?
Yeah, you kind of freeze
Off and
up.
on.
Okay, I will repeat the question one more time. So our next question is it safe to bring in caregivers into my home or move my loved one into memory care during COVID? Ms. Tam, you can start us off.
Yeah, so when, in 2020 was very different, it was all new to us, and everybody was kind of, freaked out, like, oh my God, I don't want to catch COVID. And now fast forward 2 years, and we are more familiar with what COVID is. And at this point, yes, I think what's important that you want to remember is two things. You want to know if you're going to bring in home care, we want to know the protocol of the home care agency. How do they protect their caregivers? What kind of, protection? Are they going into multiple homes, or are they reducing, their exposure? So you always want to find out from a home care agency, what are they doing to try to minimize the potential of getting COVID. And the other thing I really encourage my families to do is to see what they can do about getting consistent caregivers, because we don't want 10, 20 caregivers coming in at any one time. We want to minimize that exposure. So when you're interviewing and bringing in a home care agency, you want to ask them, to really try to be as consistent as possible using the same caregivers, so it minimizes the exposure. And then if you go into a care community, what you need to know is care communities, in order to manage COVID, if there's a COVID outbreak, they go on lockdown. What does that mean? You no longer can go in and visit your loved one. So that can be incredibly hard and depressing. So if you're going to move your loved one into a care community, you want to find out what the protocol is there as well. Different care communities are going to have a slightly different protocol. Some go on complete lockdown, can't go in at all. Some, depending, they'll show your card, your vaccine card, and they may let you visit for, 30 minutes. I know the exception they'll make is if your loved one is on hospice, but you definitely want to find out what the protocol is, the COVID protocol, so that you know what to expect. And if not being able to go see your loved one during COVID lockdown is going to be super upsetting, then you may want to try to find other ways to work around and provide the care for your loved one.
Excellent. Dr. Mand.
I think in addition to what Tammy said, which is very, very valuable, you may also want to take a look at your family situation, your siblings, who's able to help, because we are still dealing with COVID situation and the isolation for the elderly, and you not being able to see your loved one is very, very traumatic. It is just unbelievably taxing on the emotions of everybody, and we are seeing the byproduct of what has been happening in the last 2 years. So I think when the time comes, I would really, if you have siblings, if you have even cousins or whoever you have available, I would have a meeting. I would try and see who can help, who can reduce your burden, and maybe among all of you and a caregiver, you can take care of the elderly for a while longer. But of course, if not, I mean, everybody's financial situation is different, and geographically, sometimes we live far apart from one another. So you may have no choice. I mean, in that case, well, you do the best that you can after doing some homework and figuring out what their policies are and which facility is better for your particular needs.
Very, very well said. Dr. Mandati?
I have to agree with Dr. Mand and Tammy's recommendations. I think as long as the facility takes the appropriate precautions, it can be safe to bring your loved one into the memory care unit. Being vaccinated, regular testing, wearing masks when necessary, I think can go a really long way. So.
And I agree. I think, there are a lot of factors that we've implemented because, as Tammy said, this has been 2 years now. We've gotten a little bit better at it. I think it has mitigated some of the risk of spread and severe illness, which is, a little bit comforting. But obviously, this is a personal decision. And I think, like we've been saying, too, it's kind of you want to be organized. You want to have a list of questions, and you want to be able to put it yourself in a setting that you feel comfortable, that your family feels comfortable, that your loved one feels comfortable. I don't think that there's any sort of scenario that'll make somebody 100% comfortable, but that's a decision you have to make and try to get that percentage as close to 100% as you can. Our next question is, can people get over mental illness without medication? And we'll start with Dr. Mand.
Okay, so I'm going to be a little PC over here, so hang in there with me. Not all the problems that we have is mental illness. If somebody has issues with their spouse, if somebody's got questions with parenting, if somebody is feeling a little down, whatever. These are not, in my opinion, mental illnesses. They can use help for sure, for sure. But so we have to really identify what mental illness is. So if a person is dealing with, let's say, bipolar disorder, if they're dealing with major depression, if they're dealing with schizophrenia, these are mental disorders. And there is nothing to be ashamed of. It's just like anything else. As physical situation, there's mental situations. So with those kinds of mental illnesses, a medical consultation is definitely necessary, and oftentimes medication helps, but medication should almost 99.9% of the time accompany therapy, psychotherapy, so that they work parallel with each other. Medication does one thing, therapy and cognitive work and analysis and so forth does another thing, and together they can help. But if a person is sad, that doesn't mean they are clinically depressed. They're going through some issue. Maybe there is a loss. Maybe there is a divorce. There is, a kid going to college and they're empty nested or whatever. Situations come up. I really don't want to consider them mental illness just because they're coming to me and I'm a psychologist, but I'm happy to help. Sometimes, unfortunately, if you work with insurance, you have to have a diagnosis in order to get paid. Well, okay, in that case, what can you do? But generally speaking, I like to take the stigma out of it and just look at it as we all need some help sometime going through life. And Dr. Itasam, I think I went off a little bit. What was the question actually?
So our question was, can people get over mental illness without medication?
Mental illness to the extent that what I described it, pretty much no. If you have a bipolar, you have a major depression, you have schizophrenia, you have delusions of some kind, no. Therapy alone will not help. That's it.
Well said. Thank you. Dr. Mandati, would you like to expand upon that?
Sure. So, I think stabilizing mental health involves a lot more than taking medication, and not everyone needs medication. It could be exercising, self-care, spending time with loved ones, engaging in a hobby. This all improves mental health. However, for some, medication may be a significant part of their treatment. It really depends on that individual, their conditions, and their problems. I can talk a little bit about how medications might be used for people suffering from dementia to kind of give some context for people. So, for Alzheimer's and related dementias, unfortunately, we don't have any medication to reverse or improve the condition. However, we do have medications that may slow down the progression of dementia. Medications, you may have heard of them, like donepezil or rivastigmine. There are a class of medications called cholinesterase inhibitors. It works well for some people and not for others. So it's a conversation you should have with your doctor about prescribing. And there's another class of medications that are used in dementia that have been somewhat controversial. These are medications that are in the antipsychotic class of medications, like Haldol, Risperdal, Seroquel. You might have heard of those. They're used for a variety of mental health conditions, but they're mostly used for dementia to control agitated behavior and anxiety. Antipsychotics are not a medication that changes the dementia. It's more of a tool to kind of control behaviors and anxiety. The reason this is important is that if we can't redirect problematic behavior in your loved one, then it's kind of time to give sedating medication. And the reason for this is it might be to avert a crisis. It might be to maintain stability. If your loved one is agitated or aggressive, your loved one could get hurt. Someone else could get hurt. During that time that they're agitated, they experience intense anxiety, which can be very traumatic to them. And for all these reasons, we have to give these medications, the antipsychotic medications.
Very informative. Thank you so much, Dr. Mandati. And Ms. Tammy, do you have anything you'd like to add on top?
Yeah, I would like to add a few things. Mental illness, I think of as a formal diagnosis in the DSM-5. We have, personality disorders, depressive disorders, anxiety disorders. So I look at mental illness as a formal diagnosis, and then I look at mental health as situational. So if I'm a caregiver taking care of somebody with dementia and it's super demanding, and I start to feel depressed, or I start to feel anxious, or I start to feel, very isolated and down, then I think sometimes situationally, a little medication might help the situation. I'm not one to think, oh, medication first. It's always in my mind, the backup after we try to do other things. That being said, if we do go the medication route, there is something I am going to highly recommend, and that is you start keeping track of any side effects. The minute we put anybody on medication, whether it's the person on with dementia or yourself, you want to write down the date, you want to write down the medication, you want to write down the amount, you want to write down the time, and I want you to keep track of any side effects whatsoever. And we want to get rid of the stigma, because you're on medication doesn't mean that there's something wrong with you. We want to make the best quality of life for you and your loved one. But if you go on medication, I really want to encourage you to keep track of how this medication is working for you, because not the same medication is going to work the same for everybody. We have a lot of medications to choose from. And if we are going to medicate, I want to make absolutely certain that we've got the right medication for the right person, and that we treat the symptoms. We don't have, and the person, we have to listen to what the person's telling us. So medication is extremely helpful, extremely beneficial, but we also have to be very cautious that we're aware of what the side effects are, and that we make changes if you're having side effects from these medications.
I agree with Tammy's recommendation. Come to your doctor with the list of your medications, your side effects, have everything documented, and we'll be able to tailor treatment for you and minimize any problems or side effects down the road.
Very good points all around. I think everyone gave a little bit of a different perspective, but I think overall is a very well-rounded answer to that question. I think a lot of good information there too, so thank you all for that. Our next question will be, why do people with mental illness need to have a routine? And Ms. Tammy, we'll start with you.
Yeah, so I'm going to address this from a dementia perspective. Routine for a person with dementia, what it does, it provides structure, it provides normalcy, it also gives them a sense of purpose, it gives them a sense of value, and people with dementia need that structure. And what do I mean by structure? It doesn't have to be a rigid routine, but that we have things that we do in a consistent manner. So we get up, we have breakfast, we have an activity, and then we have lunch, and then we have an activity, and then we have dinner. And the activity can vary, but that we want to have some consistency in that routine, because we have found when a person with dementia is following a consistent routine, it reduces anxiety and it does help to improve sleep. And I think we have body memory, and we have muscle memory, and we have emotional memory. And if I'm used to being on a routine and I'm used to being on a schedule, that gives me a feeling of normal, and it allows this consistency in my body clock to kind of function in the same way that I'm used to. Because when people get dementia, you have to keep in mind their whole world changes. What was familiar at one time may not be familiar, and we want to try to keep as consistent routine, because again, it gives them a sense of structure and a sense of purpose and a sense of value.
Great points. Dr. Mandati, would you like to add anything?
I agree with everything that Tammy said. Routine is extremely important. Your body gets acclimated to a new schedule, and it's easier to continue that momentum than start something new for the first time. Um, when you have routine, you avoid that anxiety about starting something new because you've already been doing it, and that's extremely beneficial. So I thought there were some great recommendations.
Agree. And how about you, Dr. Mand?
I wanted to bring another angle into this. Routines, we start out as children having routines. And why? Because routines create predictability, and predictability creates security in children. And when children feel secure, they learn better, they feel more love, they thrive better. And that is something that we retain as adults. Needing to have some routine in our lives is good, is very good, whether no matter what position you're in, a caregiver. Well, I would be speaking more from a standpoint of a caregiver. The routine would be very, very welcome in your life, because it keeps your psyche from getting scattered, and gives you a direction and gives you predictability. And predictability is good. It's something that you know what's next, you know what to do. Let's say you're done at 5 o'clock or 6 o'clock or whatever it is, and your routine is maybe to go for a walk before you go home, or to go to the gym before you go home. A routine like that only helps you. It doesn't take anything away from you. Now, I know some people, maybe the very creative types, they get inspiration different times and they do whatever, and life is different. But I think for most of us mortals, routines are good. They're important. Staying with them keeps us more grounded, and the psyche more kind of together, as opposed to being scattered all over.
And I very much agree with you, Dr. Mand. I know for myself personally, my mental health, my well-being for sure is much, much better when I have a routine. So our next question is, does exercise help control mental illness just by itself? And we'll start with you, Dr. Mandati.
So exercise, it can be part of a global plan to help control or improve mental illness. It's a part of taking care of yourself, in addition to maintaining a good diet, keeping yourself occupied with a purpose, being mindful of negative thoughts, and taking advantage of other self-care activities. As people get older, it can be difficult to exercise, especially if there's not a routine. It can be really intimidating to start after a long break. But really, 15 to 20 minutes of exercise, some movement a day can really have a positive impact on physical and mental health. It doesn't have to be complicated. It could be going on a walk, doing some light weights, maybe doing some exercises in the pool. Make it fun, go with a family member, don't make it a chore. Just get up and move. People can be very anxious about starting to exercise. We have all these emotions built up about whether it will work, whether we'll keep up with it. We have that fear of failure. And because of that, we procrastinate because we don't want to engage all those negative emotions. So what I found helps is to kind of try to achieve small goals, bite-sized goals. So, tomorrow I will exercise for just 10 minutes, or I will do 1 lap around the park. Keeping it very small like that makes it a lot more approachable and easier to exercise.
Very good advice. Dr. Mand, anything else?
Yes, in my practice, I found that there are 2 words that people react to. One is diet, one is exercise. And so I try to reframe the exercise and just look at it as movement. Just move. We all need to move to the extent that we can. And I think the question started with, does that alone help mental illness? I don't think anything alone really helps that. It's a combination of exercise, therapy, possible medication, good nutrition, good support, and all of that is put together what is going to help. But exercise is, I think it is a gold mine of benefit. It has so much good benefit. And depending on, yes, like Dr. Mandati said, there are some limitations with older adults. And yes, of course. But my focus is generally the caregiver, because that's my specialty. And I think that if you're in a position to give care, you are still able to exercise much better than the person you're caring for. So you really owe it to yourself. It is just part of your well-being. It is part of realizing that the same way you eat to nourish your body, you have to exercise to help your body, and you have to listen to nice music to nourish your soul, or you have to be spiritual. All of these dimensions that we have, you have to nourish it. And exercise is one of the top ones, right up there with everything, with food, that is necessary for us to stay healthy and focused and balanced, so that you can do the job of caregiving, which is very, very, very stressful.
Agreed. Very well said. Hey, Ms. Tammy, would you like to add anything else?
Yeah, I'm just going to expand on what both Dr. Mandati and Dr. Mann said. I mean, they pretty much covered everything. And I think what I'm just going to do is just add another thought about exercise. Exercise, like Dr. Mann suggested, I try not to use the word exercise because there's so many negative connotations with it, and don't associate exercise with weight loss. Think of just moving your body and doing it in a way that makes you feel good physically, mentally. And I used to do a lot of speaking engagements on the psychology of making exercise a habit. And I used to ask the audience, how many of you enjoy doing things that are painful? And everybody would be like, nobody enjoys doing things that are painful, right? So if we associate exercise with pain, whether it's physical or emotional, it's going to decrease the chances of doing it on a regular basis than if we take control back and do exercise in a way that makes us feel good. It doesn't matter how fast and how long you walk, or what music you're listening to, or if you just want to do weights for 10 minutes. I think we've got to get back to doing what's natural for you that feels good. And in the fitness and health and fitness community, it's all about 10,000 steps. Why does it have to be 10,000 steps? Why can't 1,000 steps count? Or why can't 500 steps count? It all adds up when you look at it accumulatively. So I give people permission to start wherever they want. And whether you're 90 years old, you're 30 years old, you're 40 years old, and it's not about weight. And it's all about enjoying the pleasures of moving your body in a way that makes it feel good. And I think that's the most important thing. If one day you want to go 20 minutes, great. If next day you want to go 10, you go 10. If you want to go 5. But the goal I'm going to recommend is every time you move your body, I want it to feel good. And I only want you to go for a length of time that feels good. And if you're forcing it and having to push it, I want you to change how you're doing it. If you're feeling depleted and like a Mack truck hit you after you were done, you might have done a little bit too much. So your goal is to have a little more pep in your step, have a little more energy when you're done, and feel a little bit better. But I really want you not to associate exercise with pain, psychologically or physically. So it's something we embrace now more naturally. And don't compare yourself to others. Just enjoy what you can do and enjoy how it makes you feel, and do it in a way that makes you feel good. And that, to me, is what makes exercise work for people on a long-term, not short-term basis, but long-term, that you embrace it in a way that makes you feel good, and don't compare yourself to everybody else. Don't worry about getting that heart rate up. I want you to enjoy it while you're doing it.
Thank you very much for that, Ms. Tammy. And myself, as a physical medicine and rehabilitation doctor, obviously I'm a big proponent of exercise. I exercise myself, and I think we all agree that the benefits are more than just physical. I mean, there's definitely well-documented evidence that there is a lot of mental health benefit to it as well. And I think you all make great points. I mean, Habits are more likely to stick if they're attainable, if they're doable, and obviously if they're enjoyable. So very well said, everybody. So we got 2 more questions we'll go through very quickly before we go on to our Q&A. So the next question will be, how do I respond when my loved one accuses me for things I did not do? And we'll start with you, Dr. Mand.
I think for one thing, it helps if you know that you didn't do it. So, you know that you don't have to defend yourself. You already know you didn't do it. The other thing is to know that where it's coming from. It's not a reflection of you. It's a reflection of what they're going through. And based on where they're at, what level of deterioration, these things come up. And I think the key would be not to take it personally, to engage with them, to talk about it, ask, what makes you think so, or just have a conversation and see where it goes. But the main thing is not to get offended, not to take it personally, because you didn't, and that it is it's what they say is a manifestation of what they're going through. Sometimes there is paranoia. Sometimes they just forget, and sometimes this is a little bit off the track, but sometimes older adults want to talk, and sometimes they just say anything to get the conversation going. This is really something that happens a lot, because older people like to talk and younger people don't like to really sit down and listen to them. So sometimes they use it as just an opener to say something to get a reaction from you. So you just have to assess it and work with it and not get bothered.
Very good perspective. I'll hand it off to you, Ms. Tammy. Anything else to add?
Yeah, so what Dr. Mann had to say, it is a manifestation of dementia. And I have what I call the 4 Ds of dementia care. And one of my Ds is detach. And it is very difficult to detach and not take it personally. But I have this dementia mantra, and that is dementia is responsible for the things my loved one says and does. And if I can understand this is dementia and not my loved one accusing me of things because they're in sound mind, that it is a symptom of dementia, will help you to detach. The other thing I want to point out is they believe what their mind tells them. So you want to avoid arguing, you want to avoid correcting them, you want to avoid proving a point, you want to avoid being insistent. And rather than, I have 2 responses, 2 ways to interact with that. So you want to diffuse the situation as soon as possible. And so I have 2 phrases. Thank you for bringing that to my attention. Thank you for making me aware of that. And I'm sorry that I misplaced it, or I'll try to work on that, because you're not going to convince a person with dementia that you are not the one who's to blame. So rather than argue, you want to validate, you want to provide a reassuring, comforting response. And then immediately what I'm going to do is I'm going to try to redirect your attention. So it might go, you took my wallet. I might say, oh, I'm so sorry I took your wallet. I know where it is. I'll go and get it. And while I'm doing that, let's prepare lunch, and I'll go and get your wallet. In other words, distract them and get them engaged in something that will get them off of the blame game. But you do need to know that it definitely is a manifestation of dementia.
Excellent. And I see Angela just signed on, so it
Yeah.
sounds like we're running out of time.
I did, yes. We have a question in the Q&A if we want to wrap up with that, and then we can end for the evening. I know that we've answered a lot of questions, and there are a lot more that we'll have an opportunity to answer later. But if we could go with the one in the Q&A, and then we'll end from there.
Sounds good. So it is a question that is sent from a patient, or sorry, from the perspective of a caregiver. Has to do with their experience of having distress hit her in unexpected ways. She has 2 parents, both with dementia. She's managing their affairs for the past several years, no family help. It's been very brutal, it's been hard, but the patients are stable now. But the decline, as you can imagine, is raw, it's hard to witness. She came back from a weekend away, and as soon as she got home, a wave of anxiety overcame her. Nothing happened to trigger, but just coming home seemed to bring it on. It's very discouraging and upsetting to feel anxious for what seems to be no reason. So it sounds like, could definitely use some ways coping and potentially some ways to identify these triggers. Ms. Tammy, we can start with you.
I'm going to let Dr. Mandati start with it because we missed him on this last question and I want to give him a chance to answer.
I can certainly tell that this is a pretty difficult situation. It's kind of like when you got back from your break, all that anxiety kind of just came rushing back, and it was pretty distressing. It's important to understand that what you're doing is important for your loved one, and that even though you were gone for a little while, none of the anxiety really went away. It's just kind of coming back. And I think having that break kind of made you realize, okay, maybe life was better in that short period of time. But, things will get better. I was hoping maybe some of my colleagues would have some recommendations for this.
Dr. Mann?
Okay, so this is a very, very tough situation that you're going through, very tough. There are things that you need to do on a sort of acute basis and on chronic basis, meaning short-term and long-term. The things that you need to do on a short-term basis is basically focus on yourself, do some breathing, listen to some music, do whatever that gets your heart rate to go down, your anxiety to go down. You know yourself, so do whatever you need to do just to calm yourself, because when your body is in a calm state, your wisdom comes up and you can decide better. So then when that happens, you decide in terms of long term, because if you're alone and both parents need your help, you better really take care of yourself. Otherwise, you're gonna have a very, very hard time, harder than what you have today ahead of you. So you've got to do some really good thinking about how you want to move forward in your life at this point. You're going to need help. You are going to need support. That could mean a support group, could mean an agency, could mean therapy, could mean enlisting your neighbors, your family, cousins, whatever. So there are two ways you have to help yourself. One is to get yourself just put together, calm and relax your body and everything so that you can think. The next is think about what's going to happen and make a plan of action and include whoever loved ones you have to help you get yourself in a direction that this is going to be doable and feasible for you. Otherwise, it won't be. Otherwise, you'll have a very hard time ahead.
And Ms. Tammy, anything that you would like to add?
I would like to add that, taking care of a loved one with dementia is an extraordinary job, and it is overwhelming. So what I'd like to do is to use this anxiety in a way to empower you. And so there's 3 questions I want you to ask yourself. And I think I mentioned this the last time. And what is that anxiety trying to tell you? What is causing that anxiety? What is the anxiety trying to tell you? And what do we have to do differently so that we use that emotion and that feeling somehow to change what you're doing and how much responsibility and all the weight is on your shoulders. And when we get away and we go back in, it's almost like a little bit of PTSD, right? Little post-traumatic stress disorder. I got away from it and now I'm going back into a situation that creates a lot of anxiety. But I want you to use that as an opportunity to empower yourself to see what can I change? What do I have control over that will help me minimize the anxiety? And I think it's anticipation anxiety. This journey is up and down, up and down. The emotions swing from one pendulum to the other, and it just swings. So I want you to use that anxiety and that emotion to help you determine what it is you need to do differently for yourself so that we can get the anxiety under control.
I wanted to add one more thought to that. What Tammy said is really important, and it made me think about the fact that your anxiety may not all be due to what you're doing, because dealing with loved ones like that triggers all sorts of things. It just may be that there are some issues in the past that are getting triggered, that you're dealing with. Maybe you're not sure what they are and they're all getting mixed up. So it would be a really good idea to talk to somebody to get some clarity about what the cause is. Like Tammy was talking about, where does the anxiety come from? Maybe it has to do with some other issues that are getting triggered. And if someone can help you handle that, you'd have an easier time.
And I don't want you to make yourself wrong because you have anxiety. Use that anxiety again as a way to give back to yourself what you might need more of, or what you may need to do differently. Don't use these emotions against you, rather than use these emotions as red flags or warning signs to say, I have to do something different. Don't be judgmental. Don't be critical of yourself. Just allow these emotions to gauge how you're doing and what can you do to change the circumstances to help you feel better.
Great job, everybody.
Yes, thank you guys very, very much. Just from the bottom of our hearts, thank you for your time and your energy tonight. And for all of you who have attended, you'll receive a copy of the webinar, as well as links for the resources mentioned in the program. You will also have an opportunity to send in any questions that we didn't have time to get to tonight. So thank you again for your time and attention. I wish you all a very good night tonight. Thank you.
Thank you, everybody. And thank you for having us.
Thanks.
Thank you. It was a pleasure. Take care, everybody.
Thanks, everyone.
Bye.
Bye-bye.
Thanks, everybody.